HIV is a virus. The synonym HIV does not mean anything. For general people, it is a HIV is everything, but HIV and AIDS are different things. HIV is a human immunodeficiency virus, and AIDS is acquired immunodeficiency syndrome. AIDS is a disease. HIV is a virus, but usually now in a community we use HIV. Everybody do not talk about AIDS; they talk about HIV. So the infection itself synonymous with HIV, and that is human immunodeficiency virus infection. So HIV is caused by the viral infection, that is HIV virus, human immunodeficiency virus. This can be transmitted by the two things. One is by the blood, and second is by the common is unprotected sex. And other is like blood transfusion, needle stick injury, exposure to the bloody product, or exposure to the body fluid, and that is the way you get HIV. There is no third way of transmission. So commonly it is a sexual transmission or blood. HIV has four stages. One is called asymptomatic HIV, and then there is a chronic HIV. Asymptomatic HIV, the person get HIV infection, and patient is unaware of all these things. And usually this stage the patient is asymptomatic. They are not aware of they are having an infection. So sometimes they go for some other test or pre-operative evaluation. They come to know they are HIV positive. This stage can be vary from 1 day to 6 months to year. Then there is a chronic HIV. The chronic HIV, you have a HIV where you have a symptomatic chronic phase. Then you have a symptomatic chronic phase. The symptomatic chronic phase is called ARC also. That is AIDS related complex, where it is divided on the your chronic ARC or AIDS on depending on your CD4 count. We monitor HIV infection on CD4 count. If CD4 count is less than 200, we call it AIDS related complex. And the last stage is AIDS, full blown AIDS, where the count is less than 60. The last stage comes a full blown AIDS. So like we have a symptomatic phase, then you have a chronic HIV. Chronic HIV, you are asymptomatic, you have ARC, you have AIDS, and you full blown AIDS. So likewise, we stage it in 5 stages. Directly, because if you come in contact with the body fluid or blood of the person who is close to you, and you are not aware of it, and that body fluid or blood touches your the skin which has any abrasion or injury, so you can have HIV infection. The chances is very rare. But sitting with the person, staying with the person, like respiratory, like we have COVID, we do not have HIV transmission to the droplets. So by touching person, by staying with person, you will not get HIV. But by the contacting the body fluid, you can get HIV. So it is not that way contagious. Okay, you can stay with the person with HIV around you. HIV has a very plethora of sign and symptoms. You start with asymptomatic person. Person is not aware. Then comes with the mild symptom, that is we call it simple like acute HIV infection, where we can have viral fever like a symptom like body ache, fever, cold, cough, malaise. Then the stage come you may have a weight loss, loss of appetite. You may get other infection like tuberculosis, which is very common in India. Then other sexual transmitted disease like fungal infection, respiratory infection, then all the brain infection, even your cardiac complications. So these are the complications or these symptoms comes when there is a HIV stage is in ARC or advanced AIDS. In initial stage, you have minimal stage, so you can have any symptom from the simple infection of tuberculosis, fungal. You can have cancer in HIV. HIV can due to brain infection, brain TB, and so you have a very from 0 to 100 symptoms in HIV. So initial it is asymptomatic. As the disease progresses, as the counts CD4 count or viral load, which increases, then later stage the symptom increase, and it is basically immune destruction syndrome. It's immunodeficiency syndrome. So the moment your immunity goes down, your all the infections crops up. So you can have any infection anywhere in the body in any system. How often you should get tested if you are any person who is in a high risk profession like a doctor, nurses. They are working with HIV patients, or they are working with the blood fluid. Any, they can get it tested at least 1 year, or if they get uh, accidental needle injury. And any patient who is undergoing any surgical procedure, usually every hospital does the blood test. But normal person who is not having any risk, there is no reason to do HIV. But nowadays, if you are going for a surgery, any hospital you are getting admitted, they will. Sexual, if you have unprotected sexual contact with any person, then you should do it. And sex worker, they have protocol. See, they should go usually undergo 6 months, 1 year HIV testing in all the area in India or anywhere in Maharashtra. That is a common protocol. But a normal asymptomatic person, like we do the blood sugar, we don't advise you go and do HIV. You should have a reason to do the HIV testing. And before doing HIV testing in asymptomatic patient, we have to consult patient. Why we are doing? The person has a fever which is unexplained. Person has a weight loss which is unexplained. Person has other multiple disease which is not explained by the any pathology where we doctor asks. Then with the counseling you can go for HIV test. Otherwise, just for heck of it, we don't do HIV testing. And how to diagnose the HIV? There are screening tests and then there are confirmatory tests. The screening test commonly available is everybody knows is the ELISA test. Then there is a PCR test. Then there is P24 antigen test, which detect the HIV early. Or in an advanced state, we do a Western blot, then CD4 count and viral load. These are the specific tests to monitor the disease. For diagnosis, we do ELISA and C. That is a primary test. If ELISA is positive, we go for a PCR or Western blot, depending on the requirement. So primary test is screening test is ELISA. That there are so many patients who comes with pregnancy and then they found out they are pregnant. So that pregnancy can be continued and they should be started on ART and they should take care person going under medical supervision. The delivery is conducted under supervision and they should give ART to the unit also. Uh, they should monitor the infant for at least 18 months and they do the DNA PCR and monitor the infant for same thing. And if the infant has positive test, then they can start the ART to the infant also. There is something called exposure prophylaxis and post exposure prophylaxis. That can be done. But if you are know that you are HIV, usually we avoid not to get pregnant. But we have a situation here in hospitals where patients are come to doctor after getting pregnant and they know they are HIV. In such a patient, the pregnancy can be continued, but you have to start the and you monitor the patients for all the complications. In initial days, in asymptomatic HIV, you may not have any complications. You have a normal weakness, fatigue, malaise, loss of appetite, loss of weight. But as the disease progresses, you can have a infection that comes from the chest infection, combination of India is tuberculosis, lung infection, pneumonia, different type of. You can have abdominal infections, and abdominal TB, emphysema, cancer, fungal infection of the chest, the brain infection, brain meningitis, cardiomyopathy of the heart, you have urinary infection. Practically, HIV can affect any organ of the body. You can have HIV dementia, HIV neuropathy, HIV related paralysis, HIV related brain tumors, HIV related cancers. So there are so many diseases that are associated with the HIV infection. HIV, there is a now things have changed. Initial days in 20 years back, it was different. Nowadays, we have HIV that is called HART, highly active antiretroviral treatment. There are antiretroviral drugs who are very effective, bring down the viral load. They reduces the symptom and person can live a normal life with the treatment. And you have to just monitor the CD4 count and their viral load. This treatment can go for 10 years, 15 years, depending on the patient's response. Every person has a different response. Some people will respond very nicely. Some people can go into complications. Some people develop a drug resistance to the primary ART, that is antiretroviral drugs. So nowadays the things are changing, and with advanced treatment that they are saying we are as good as we are curing the HIV. There are some cases are reported all over the world where the HIV has totally gone, but they are very rare cases. So still there are so many studies are going on. So at present we can say the HIV person can live a normal life, which is ART, but he has to take the treatment regularly. He have to monitor his treatment. Prevention of HIV has a very basic things like you do the safe sex. You take the precaution when you are related to any medical field. Like you take the precaution when you are touching, you are dealing with HIV. Especially, you have to take regular wear the gloves, avoid the needle stick injury, avoid direct contact with the blood and the body fluid of the patient. If you get a needle stick injury, you can go for a post-exposure prophylaxis also. But for a general people, it is a safe sex which is important. You use a condom. That is the best thing if you are going encountering any sex with an unknown person or the person with a high risk of having HIV. So you do the safe sex. Safe practice of the sex is most important.